Hi, I'm Dr. Elizabeth Livengood, medical consultant with Yahweh Yoga, and one of their teachers in the RYT 200 and 500 hour programs. I'm also a yoga instructor and a licensed naturopathic physician practicing here in Phoenix, Arizona. Question for you. What do you do if you have high blood sugar, but you don't need medication yet? Let's get the obvious out of the way. If you have high blood sugar, you need to stop eating sugar. But there are some other sneaky foods that might surprise you, which can also raise your blood sugar levels. I'll reveal those at the end of this brief talk, but first, let's look at some other things you can do to lower your blood sugar and prevent it from becoming full-blown diabetes. First, diet and exercise are key components of the lifestyle changes you need to make in order to change your blood chemistry and improve the functioning of your pancreas and liver. You can actually do that. High blood sugar is simply your body's warning that it's time to get serious about what you're eating and how much you move. As a naturopathic doctor, I use 3 guiding principles for dietary suggestions with my pre-diabetic patients. Number 1, eliminate sugar and reduce refined carbohydrate intake. Number 2, reduce overall food intake to match either your weight loss goals or your basal metabolic rate. And third, increase the quality of foods so as to reduce your body's burden in trying to digest foods and detoxify them. Next, incorporate intentional movement throughout your day. If you start your day with 10 minutes of cardiovascular exercise, it increases your metabolism rate all day long. So this could be getting up and walking around the block for 10 minutes or simply doing some cardiovascular exercise right in your house. Quick and easy. And then set up reminders on your phone or your watch to remind you to get up and walk around your building or your block again about 3 times throughout the day. Hourly is even better. But by doing this, you'll get in at least 30 minutes of movement or some form of exercise every single day. Incorporating movement literally takes only a few minutes, but you'll find that you can think more clearly, be more productive, all while lowering your blood sugar. Now, despite our best efforts, many people still need supplementation to help reduce their blood sugar levels. Here are some of my top recommendations for reducing your blood sugar. I recommend taking a diverse probiotic with at least 10 billion CFUs every day. This will help protect your gut flora and decrease inflammation in your system. That way, an occasional inflammatory meal won't have nearly the impact on your blood sugar as it normally would. My number 2 recommendation is curcumin. It's been shown to prevent the progression of metabolic syndrome into type 2 diabetes. However, it's really important to get a bioavailable form and take it in sufficient dosing. So the best form that you can take orally at this time is called liposomal curcumin. It's bound to a molecule of fat for easier absorption. Other nutrients in therapeutic doses can also help us with carbohydrate metabolism, sugar metabolism, and even insulin production. These include B1, B3, B6, chromium, magnesium, vanadium, and zinc. So I like to use a supplement that has all of these in one package directed towards lowering blood sugar. Finally, certain herbs and even acupuncture have been shown to reduce blood sugar. So ask your naturopathic doctor or an acupuncturist about these specific protocols. So what about those sneaky foods I mentioned at the beginning of the segment? Grab a pen and paper or your phone and jot these down because you're going to want to keep them handy while you're going through the grocery store. Primary research by leading gastroenterologists has shown that these foods are directly associated with the following illnesses: obesity, insulin resistance and diabetes, arthritis, inflammatory bowel disease, intestinal permeability, autoimmune diseases, and even colon cancer. So are you ready? The first one is maltodextrin. This is a filler and a preservative. It's found in salad dressings, baked goods, and other processed foods. The second one is polysorbate 80. It's also an emulsifier and a stabilizer. It's found in gelatin, gum, and even vitamins, so it's important to get good quality vitamins without these sorts of additives. The third one is cellulose gum. This is a synthetic fiber, and it's also a stabilizer and a binder. So it's found in things like ice cream, Jell-O, gum, and even baby food. So again, watch for additives in foods that you normally would buy. Lecithin is another emulsifier, and the main problem here is that it's often derived from GMO soy. So it's not that you can't have soy or vitamin E or lecithin, but watch for the source. It's the GMO that is the problem. The next one is artificial sweeteners. These actually raise your blood sugar even more than plain sugar, so absolutely avoid them. The last one, you ready? It's milk fat. The problem with milk fat is that it contains high amounts of a bad bacteria called proteobacteria. This can throw off your gut flora, which you'll remember we're trying to correct by taking probiotics. You can help avoid this by using organic milk products and dairy if you're not lactose intolerant. Proteobacteria have been implicated in Crohn's disease, which can lead to colon cancer. So you can avoid this by getting organic milk and dairy products or avoiding dairy altogether. So what do you eat instead? Well, there are plenty of options. And the following foods have been specifically researched to lower your blood sugar. They are asparagus and artichoke, onions and garlic, bananas with the strings left on, good fats such as omega-3s and short-chain fatty acids, as well as complex carbohydrates. These provide natural sources of fiber. Know that we're here for you. You may contact me at Dr. Livengood at yahwehyoga.com or visit my website, drelizabethlivengood.com. I'm seeing patients in person in Phoenix, Arizona, or via telemedicine anywhere in the world.